99.9 Santa Barbara's K-Tide. It is the Morning Mojo with Lynn and Bill, and we are really, really excited about the guest we have waiting for us on the phone.
We have Dr. Paul Erickson here from Cottage Hospital. Doctor, thank you so much for joining us.
Good morning.
Yeah. And what is your title, your exact title, sir?
I'm Psychiatry Medical Director at Santa Barbara Cottage Hospital.
You got to have a big business card for that, don't you?
Yes, I do.
So first of all, Dr. Erickson, thank you for spending a little bit of time with us this morning. I would imagine that your schedule has been modified as well, probably to the extreme.
Everybody's schedule has been modified, I think, yes.
Yes.
And everybody's so busy now. And so, we have a few questions we'd like to ask you. A lot of our tribe members here at K-Tide, they're very... a lot of them are self-isolated. We have a few that live alone. And we were wondering, how do you deal with that? You get up in the morning, you watch the news, it looks like the world is ending,
you know? Keep the news on,
right. Oh, it's a time when people are very worried, very anxious. Their usual routines are disrupted. So it's very unsettling, really, for many, many people. I think there are some really fundamental things that help. One is to keep to a schedule during the day. You should actually, I recommend, put it down on a calendar about what you'll be doing throughout the day, whether it's calling a friend or taking a walk or cooking a meal, to bring a sense of organization and control to your day. It's easy to slip into binge watching, and that's not a good long-term strategy. So that would be one thing I'd recommend.
Okay, well, that, because we all need structure, don't we, in some way?
Exactly.
Yeah, we all need that, no matter how old you are,
Structure and routine are very grounding for everybody.
Right.
And it's important, I think, to get exercise every day. You might look at YouTube and find a yoga practice or a workout that you like, or you might just want to go for long walks. But I think getting outside every day and staying physically active also helps a great deal.
I've talked to a few people, tribe members and family members, et cetera, and I think one of the other things that's kind of underlying here, and it hasn't grown sprouts yet, but it's kind of a dread as to the longevity of this thing, and I don't, I'm not personally feeling this, but I do have people that are close to me that are. So is there a way to maybe manage the oncoming dread?
Right. Because I think for many, we thought this might be a few weeks of being at home. I think now it could be many weeks, and it's really uncertain how long this will be. So I think taking the perspective that you're not just getting through a couple of weeks that are different, but you really are changing your life for perhaps many weeks. And I think just having that perspective can be helpful, and thinking about what is going to help you be healthy and cope well on an ongoing basis is important to be aware of and to take an active approach to grounding yourself.
Right on. It's also I talked to one of the tribe members. They're also they're afraid of the coronavirus, of course, but now people are laid off. Financial issues are starting to affect them now. It's like a storm rolling on them,
Yes.
And how do you cope with that? I mean, what do you do with a situation like that?
Well, I think some other fundamental things that are important to do are to make sure that you're taking care of your physical health by sleeping well, by eating healthy, by staying socially connected, which helps emotional health and physical health. I think reaching out to family and friends, maybe people you haven't talked to in quite a while, also helps people to feel some sense of reassurance and support. And then I think realistically confronting, many people have to make a lot of adjustments financially and otherwise, and to take an active approach to doing that.
Right. Don't let it slide. Just really get on top of it.
Exactly.
Yeah. You know, it's funny you say about eating healthy. Anytime I feel stressed, like I'm at KFC with a bucket of chicken.
Really?
I swear to God.
Right.
You know, for some reason, I crave the grease.
Yeah.
You know?
Yeah.
Right.
I know. But eating healthy is most important, I think, too.
It is, and people have more time now, and it's a chance to, if you haven't been cooking much before, begin to do that or try out new things. And it's a way that brings family together around a meal. So that's a good thing to do.
Right on.
So let me ask you this. I know we need to wrap this up, and we don't want to take any more time away from your important work, but the Bridge Clinic, can you touch upon what that is, and is that local?
So many people who have substance problems are at risk for relapse or worsening of their problem during a time like this. So being aware of that and seeking help can be very helpful. The Bridge Clinic is a collaboration between the Santa Barbara Neighborhood Clinics and Cottage Hospital, where the door is open to anybody with a substance problem who would like help. Oh, wow. So you can just look us up and call and come in, and we can see you very quickly and provide a lot of help for people who have a substance problem. I'll also mention this is a time when domestic violence problems can worsen, and I want people to know that Domestic Violence Solutions remains open and available and is there to help particularly women who are in crisis. So those are a couple of resources to keep in mind.
Oh, you're so fantastic.
Well, Dr. Paul Erickson, we thank you so much for spending some time with us this morning. You've got a soothing voice, and
I know.
I feel a lot better now.
I want to call you and have you read me a bedtime story.
I'm glad it's been helpful. My pleasure to talk with you, and take care of yourself.
You too. Thanks so much, Doctor.
You too, Dr. Erickson. We appreciate you. Thanks for your time.